The session will take 1 hour from now, and I would like to take this opportunity to welcome the moderator, Professor Hai Kuge, to welcome the panelists so that the forum will continue. Welcome, Professor.
Thank you very much, THS, for affording us this opportunity to be able to showcase what Bakwata and other faith-based organizations are doing. So today, I have a set of panelists who will carry us through this journey. And I would like to invite them one by one to the stage so that they can get us running. First and foremost is Dr. Mariam Mongala. Dr. Mariam Mongala is well known in the PPP sector. She coordinated the PPP in the Ministry of Health, and she's an advisor part of PPP. Dr. Mariam Mongala. Secondly, I would like to recognize and welcome Dr. Saleh Abdallah. Dr. Saleh Abdallah is the health coordinator of Bakwata headquarters, and he is a renowned physiotherapist, rehabilitation specialist, but now he is helping us to put things right at Bakwata headquarters. Then I would like to recognize and welcome Dr. Muhidini Kasim Mahende. He's a clinical epidemiologist, but he's a secretary of the Bakwata Health Services Forum, which is a network of health professionals in Tanzania and the Muslim health professionals. Last but not least, because of his size, is Dr. Abasi Musa, the Deputy Secretary of the Bakwata. He's a health insurance expert, and he knows a lot of things in that regard. But today, we made him another challenge. Thank you, sir. So, we have 1 hour, and this 1 hour, I'll guide my colleagues. I'll guide my colleagues so that we can elucidate the journey, the participation of Bakwata in the PPP as well as so the introduction, the original, the panel was introduced in the booklet which you see what we are doing. So what we are going to do here is to briefly introduce you what Bakwata does in general, but also about the public-private partnership. Bakwata, the National Council of Muslim of Tanzania, is the supreme government body. It's responsible for all religious affairs of Islam religion, but also it represents the interests of all Muslims socially. But it's everywhere in the country. It's a national organization. In addition to the religious affairs, Bakwata also promotes unity in Muslim communities and other partners in issues related to economic development, education, health, women development, peace and justice. Today, we focus on the health part of it. And in health, as will be told by panelists, we have partnered with the government and other stakeholders, including we have a trinity of Africa, CSSC and Bakwata, which we consider ourselves as the private sector in Tanzania. And we've been working so with all these stakeholders, we implement diverse programs, which will be shown. And our activities include facility-based, where we own and operate some health facilities, but also we operated by one executives. At the same time, community-based interventions and also we participate in the health sector. So so those will be shown in this discussion. I talked about participation in the after the CSSC. So we have many FPOs we work with. So I left today here. Rafa is represented. Rafa, can you raise your hand, please? Rafa. We have someone from Rwanda, we have others like Nico, Timer, SMV, African Mathematics, which have health facilities and but also we have FPOs which are operating in the communities. First and foremost is Bakwata, which is an arm of Bakwata, which does a lot of community-based activities, but also we have Nibora and Tampo and many others. So today, our panelists, as I said, will take us for that journey. And I would like to bring before you Dr. Mariam Ogala. Mariam, can you refresh us on the pyramid of healthcare delivery system in Tanzania and in the context of PPP? What firms, policy, strategies, to facilitate PPP and how does that part of it?
Good morning, everybody. So, first of all, I'm told to refresh on the health service pyramid of Tanzania. Before I talk on the health service pyramid, let me talk on PPPs. What is PPP? PPP is a collaboration between the private sector and the public. These two entities form public-private partnerships. And what public-private partnerships are crucial for enhancing health service delivery. It means that we get innovations, efficiencies from the private sector. And also it addresses the challenges faced by the health sector. As FBOs are non-governmental organizations and they are complementing government efforts. So after that, now let us go to the health service pyramid in Tanzania. The health service pyramid in Tanzania, it encompasses public and private sector. You can see that we have one side public sector and the other side we have private sector. So all of these, that is the health service pyramid, and it has 7 levels. The first level is the bottom one, which is the community level, and the second level we have the village level. The third level is the ward level. The fourth level is the council or district level, and the fifth level is the regional level, and the fifth level is the zonal level, and you have the national level. So on these levels, we have health service being delivered in all the 7 levels. For the community level, we have community-based programs where community-based programs are taken to communities and to households. At the village level, we have dispensaries. So in case of faith-based organizations, we have dispensaries affiliated to faith-based organizations like Bakwata and Christian Social Service Commission. And at the world level, we have services being delivered to the health centers. So on the public side, we have health centers, but on the private side, we have health centers which are affiliated also to FBOs and other private for-profit entities. Private for-profit, they don't like calling them private for-profit. Dr. Makaranga is there. They like to be called FBOs, we have designated district hospitals. When we have a district or a council which doesn't have health facility or doesn't have a hospital, then they are entering into agreement with the faith-based organization, allowing the FBO hospitals to be designated district or council hospitals. And at the regional level, we have referral hospitals at the regional level from FBOs. And at the zonal level, at this level, we have also zonal hospitals. Actually, the zonal hospitals which belong to FBOs in Tanzania, we have Uganda Hospital, SNC Hospital, those are at zonal level, and they give advanced care. At the national level, we have the organizations like Bakwata, Christian Social Service Commission. They are having networks of the health facilities, but they don't have really health facilities at national level. It is the government which is having hospitals at national level, like the Memorial Hospital, Moi, Ocean Road Cancer Hospital, etc. So this is the health service delivery pyramid of Tanzania, and it starts from the community level to the national level. At each level, the big players are the public and the private sector. So the private sector is complementing government efforts in service delivery. Coming to the frameworks, the public-private partnership frameworks. Yeah, the government of Tanzania is established enabling empowerment for public-private partnership to flourish. What we have, they have developed implementation guidelines, like we have the PPP policy of 2009, we have the PPP Act of 2010, and it has been revised in 2023, and we have the regulations of PPP regulations of 2011, and they have been revised in 2023, 2024. Furthermore, the Ministry of Health has developed guidelines. The guidelines were developed in 2013, guiding the sector towards public-private partnership. And we have also the public-private partnership service strategic plan, whereby the strategic plan is actually 2015-2020 is outdated, but it's the strategy which is currently in use. Furthermore, the government has developed templates, service level agreement templates. These are tools when entering into service agreement between the public and the private sector. These tools are used to enter into service agreement. So these are the frameworks actually which are used for enhancing or strengthening implementation of public-private partnerships. Furthermore, we have the Health Sector Strategic Plan 5, which is also talking or guiding what should be implemented on public-private partnerships. Thank you.
Thank you very much, Dr. Mariam, for setting the ball rolling. And now we'd like to go inside and see what we do in Bakwata. So I'd like Dr. Saleh. Dr. Saleh, can you tell us how does Bakwata and its affiliated faith-based organization participate in expanding the availability, access, and quality of healthcare in the context of the city? Let us know what is happening in all aspects. Karibu sana.
Morning, everybody. Thank you very much for providing me this opportunity to express what we have in Bakwata as far as the universal health coverage is concerned. First of all, I would like to express a sincere from the Supreme League of Bakwata, the League of the Moved and Moved. So, I would like to express sincere greetings also from the Chief Executive of Bakwata, the General Secretary, and also on behalf of the Director of Health Services, Health and Social Services of Bakwata, is Asina Shenduli, who's among us. Maybe she can wave her hand. She's the Director, and I'm the Coordinator. Thank you very much. As the question itself goes, I would like to express what I have in 3 categories. The first category will be on the service, second category will be on the infrastructure, and the third category will be on the partnership. Starting with the service provision, as it is, Bakwata is working along other organizations. As it was mentioned here, we have Christian Social Services Commission, CSSC, AFTA, and others to see to that we are providing state-of-the-art services in Tanzania. Of course, currently we don't have, as it was mentioned by Dr. Mario, that we don't have the national level infrastructures and systems, but we have these structures in other levels. And also, Bakwata, apart from working on seeing to that guidelines and guidelines are benefiting people, we are also trying to see to that we are providing state-of-the-art services. Going to the infrastructures, as it was mentioned, we are striving currently to see to that we are erecting structures which will be sufficing the need of the public as it is. And also, as for collaboration, as it was mentioned, there are so many instruments and guidelines which are being provided by the government, and Bakwata is following them. So it's not that we are coming with our own guidelines, but we are following the guidelines which are there, provided by the government and being developed by our people, as it was mentioned by Dr. Mario. So we are also striving to see to that if government is coming up with some other new proposals as far as the health financing is concerned, they should be remembering Bakwata, because Bakwata is among the members or among the organizations which are being identified to be the partner in development. Thank you very much.
Thank you very much, Dr. Saleh, for that, and maybe if the panel has questions, we will take them. Now I'd like to turn to Dr. Muhidini Mahende, who is one of the key partners in Bakwata. Can you tell us what role has Bakwata played to accommodate PPP with respect to health-related, community-based services and beyond hospital care services?
Thanks very much, Moderator. Good morning, everyone. And as the Moderator has highlighted that we have to explain a bit about how quality of health care, PPP, decides to be loss of coverage, which most of them have touched on the maybe explicit basis. But I think we all know that tackling diseases, something has also been happening at the community level. luckily or historically, we have seen that the community interventions through the healthcare workers have been implemented informally, but as of recent, we have heard that the ministry has agreed to endorse, and we already have a manual on community healthcare workers who will be adding efforts in implementing interventions and other activities that are meant to tackle the health challenges in the communities. So Bakwata is another organs playing a crucial role in provision of health services in the hospital-based setup, but also there are a number of activities which are happening at the community. And we know that most of the activities are based on preventive approaches, whereby you need to make sure that people are not coming to those facilities to get treated, but rather they are prevented from getting diseases. So Bakwata, in doing so with this affiliate, is conducting some preventive approaches, which is targeted to various groups of the communities and of interest are the young people and children. There are a number of activities going on in the communities, making sure that people are well versed with challenges happening in their environment, also with all those issues that are happening at a national level, so that there should be preparedness in terms of preventive approaches, but also in issues related to healthcare seeking. Through that, also Bakwata has some initiative at the community levels, in groups and individual communities where health challenges are addressed and interventions are implemented. That Bakwata has also, with its affiliates, promoting core services to special groups like orphans and vulnerable children. Their activities, as I mentioned earlier on, happen in Spain, but also in Kigoma, but also through Jalibura and other members of affiliates of Bakwata are conducting medical screening and treatment, which are happening outside the hospital setup, where children or vulnerable groups are happening to receive medical screening and treatment at their community setup. Not only that, we know there are issues in communities in terms of understanding and health care, understanding on issues towards positive behaviors, gender norms, but also some issues on adolescents and women. So Bakwata with its affiliates are conducting a wide spectrum of activities in the communities, making sure that gender norms and other issues are well versed and people are taking cautious measures. Lastly, I would want to specifically do what Bakwata is a religious body, whereby religious leaders are also versed with issues pertaining to gender-based violence, issues, violence against children, issues related to sexual and mental health, but also issues pertaining to gender issues, as I said earlier on. So religious leaders are also part of the interventions which are doing the Bakwata, making sure that they pass the knowledge and information during the congregation and public gathering, so that issues related to health could be addressed properly. And with that, we might be able to attain those various facets of quality of healthcare. We're doing good work in the hospital setting, but also some issues or work to be done at the community level.
Thank you very much, Dr. Muhidini, for that. So we've seen what Bakwata is doing at the national level, the PPP as well, what is doing in the health facility, and what is doing in the community. I would like Dr. Basi, can you take us through what our colleagues have said, highlighting what challenges does Bakwata face and Bakwata himself is face in effectively implementing the PPP initiatives and delivering safe and high-quality healthcare services. What should be done about those challenges?
Thank you very much. Good morning.
In fact, despite the major efforts done by Bakwata and its affiliates in putting weight on healthcare services, there are challenges that Bakwata, along with the affiliates, are facing in terms of moving the agenda of PPP. One of the major that's not only Bakwata is facing, but even other areas, including other entities, including the government itself, is financial limitation. We find that we have very good motives. We see some of the support of Bakwata, like some out of the organization web organization like Nico, who are putting much effort into establishing health facilities, and they are facing difficulties in running these facilities to sufficient because of limited financial resources. We have the Rigora, for instance, is doing much, as it is being spoken by Dr. Begin. There are a lot of community programs, including gender-based violence and violence against children, with the touch of Muslims, as much as part of the community. You see there are a lot of community child-based violence that are being addressed in media and so on. And these organizations has established a number of programs so that to tackle the gender-based violence and the violence against children, in the perspective of madrasa as well as in mosque. But these programs are ending premature because of lack of financial resources. As we said that looking at another affiliate like JI is doing a very good program for home care as well as hospital-based care for patients, those who have no relatives who are facing difficulties in handling the hospital matters. They've been delivering medicines and so on, and nursing care in the facilities. But the major challenge they're facing is that the finances are only obtained from just member donations. This is what is a major challenge. The other challenge is to have a stable and well-known modes of monitoring and evaluation of these programs. As we say that the food is done, but how would have a robust modalities to monitor this program and ensure that they are sustainable. We don't have that one because we want to seamless back to the financial resources. Going ahead, that utilization of information and what data available from the operations, as well as what the utilization of available data from research, as well as the data that are obtained from the National Health Information Data System. Due to lack of manpower, expertise, and finances specifically, then it becomes difficult to utilize this kind of data so that to ensure further sustainability of these programs. Additionally, in that most of the affiliates who go to Bakwata, they fail to maintain their long-term strategic plan. In fact, we have some hospitals that had very good motive, very good contribution to the society. Looking at the example of SSB Hospital, that was very peculiar in terms of giving privacy to maternity services, but it ended difficultly and prematurely into lead because of lack of finances and having long-term strategies to sustain such programs. We have some facilities that have been opened And they put themselves, everyone wanting to premature death because of what of lack of sustainability programs and long-term strategies to obtain this. So we have a number of challenges that are facing. Few have been what is discussed. So what is the way forward? In fact, what
Okay, Dr. Abasi, thank you for that, and I would like you to start the last round, which I want each of you, of the panelists, to say very quickly, addressing these challenges, what is the way forward? So I'll start with Dr. Abasi, and then the others can chip.
Thank you very much, moderator. It's the only time that you select me to be the first. Thank you. Yeah, let's address that as a major challenge is what is lack of financial resources. What I see is we can diversify in terms of what of the financial resources instead of what of considering only single source. Like most of these services and programs, as well as health facility, are run by just collection from members, collection from the community. But we can now see how we can add other sources of finances. We can invest, for instance, and the return on investment we can bring it into our program. We can establish a number of sources of investment. Those who are good in finances and investment, we can take them into all the note advices as how can we invest so that in turn we can come up with a significant amount that can run these facilities, especially those facilities that are giving back to community completely and they are of no profit. Yeah, we can have the other thing apart from donations from members. We can focus on seeking donations from international organizations, friends. We can take them in and then and make this run. Thank you.
Thank you very much, Dr. Muhidini. Can you chip in?
Thanks very much, Mr.
I talk on this issue as well to address how we can strengthen PPP. With that, we are trying to make sure that we provide safe and provide quality of care to all residents, hospital itself, but also the community level. Mine would be that the way forward is to make sure that I'm happy that after the house and is part of the regulatory body to our institutions of the ones. We have to come up together to make sure that whatever is happening, whether at the hospital center or the community level, interventions that usually should be safe. But as we know that quality of care has many faces, one of it being safe. So we make sure that wherever it's happening at the community or the setup is safe, and making sure that the facilities but also interventions are well designed. To make sure that we make efficient use of the resources we have, making sure that it will help us deliver the quality of healthcare services. We need to make sure that we embrace effective approaches and innovative ideas in delivering both community-based intervention but also hospital-based services. As we're embarking on welcoming the community healthcare workers, we also need to make sure that the approaches and interventions designed should be partially centered, seeing that the need of the community should be well addressed when we design interventions and activities to the community. But also timeliness of implementing of the activities which are designed to go to the community, but also the hospital setup, which will also make sure that we achieve the level of quality struck. We also need to make sure that equitable access of the healthcare services by making sure that not only that as
we see most of the services or non-services happening in the town centers and big cities. Also, in the community activities, some are quite biased in terms of how they are implemented. We have issues like donor-funded influences, but we need to make sure that the interventions we design, the activities we carry out, go in a repeatable way, making sure that we reach each and every needed, particular individual in the country.
Thank you very much, Dr. Salehe. Can you chip in that same question?
Yeah, thank you very much. Currently, Bakwata is implementing a lot of initiatives along with other organizations. We have organizations like Norwegian Church Aid, Catholic Relief Services, all these are the FBOs. So we are implementing some initiatives along with them. Bakwata also is key in building its capacity to see to that it's still getting some more investors as far as the health services is concerned. As it was mentioned here before, not just the institutional health facilities, but community-based health services as well. Fundamentally, Bakwata is the FBO, faith-based organization. But also in social aspects, we are identified as the reliable partners as far as the disaster is concerned. Disaster management, disaster rapid assessment and implementation and interventions. Bakwata is also looking forward to be working with some other people who are interested to be working with us. And Bakwata is probing because we understand there are some initiatives by the government whereby there will be some financial availability as far as the health services are concerned. So Bakwata is ready to be working with some other people. Thank you very much.
Thank you very much, Dr. Salehe. Mariam, can you also chip in?
Thank you very much. As a way forward to challenges, we have seen that there are PPP frameworks which are outdated. So we request the Minister of Health to review the PPP framework so that we will be in line with the current situation, so that the PPP frameworks can be distributed to faith-based organizations like the guideline, the service agreement templates, etc. And also, we think it's very important as a way forward to build the capacity of FBOs on PPPs, including service agreement at all levels. And we also think that FBOs can advocate for supportive supervision, and this should be a joint supportive supervision. It should not be only from the Minister of Health supervising as regions, but also FBOs participate during supportive supervision. It will help build capacity on FBOs, and it also enhances, it reduces mistrust. Furthermore, we used to have public-private health forum. This is a dialogue forum, so we think it is important for FBOs to advocate or to ask the Minister of Health to revive public-private health forum at all levels, because the public-private health forum will help to reduce the mistrust, as I said, and also will help to strengthen public-private partnerships. So I think if public-private health forums are revived, then we will be in a better way. And also, as a way forward, we should advocate for effective and meaningful public-private partnerships. It means that meaningful partnerships, not only the public, but all because the faith-based and the private sector, they wanted to suspend services to communities because there was mistrust and they didn't understand there was no enough dialogue and participation of the faith-based organizations. Thank you very much.
Thank you very much, panelists, and I would like to take some time to welcome you members to raise some issues and some comments. Then we can see whether we have time for a last word. But if we mentioned about Bakwata having health facilities, it is a very big initiative of building health facilities in each council ongoing. And I would like to recognize Mr. Sabila Raphael. Can you raise your hand? You are moving the slide. He's helping to coordinate the backup efforts in that. And now some regions like Mwanza and Kagera are in different stages of building. There were some pictures here you can see there. There are much more. This is a plan of the hospital now that we built. So thank you, Mr. Sabila, for joining us. Now I would like to welcome members to contribute, ask questions, even challenge us, because then it would be better if we get some sticks in our chairs. Yes, Karibu. Don't tell me time is over.
Good afternoon. Thank you for the nice follow-up. I was following up. I got two questions to all the panelists. And the first question is, I know Bakwata is a faith-based organization. And as I was following up, I found that it is dealing with matters such as gender-based violence, the sexual and reproductive health, and family planning. So I wanted to know what are the challenges that you face because there are some religious facts which doesn't align with science facts, and you are faith-based organization. How do you deal with that, and how often do you get the challenges? Then the second question is about the challenge you say that you face on health information systems. As I find this is a crucial issue, but I saw you discussed most on finances. So I know as Bakwata you do outreaches and matters alike. So where do you usually publish your reports so that we can get to know, and how often, and maybe what are the plans that you have to make sure that the information that you have from the field goes up, that can be used to make decisions that affect the whole nation. Thank you.
Thank you very much for those two very interesting my panelists to respond. Although we don't have some studies here, people are well versed in the Quran here and how it gives us guidance in all what we do. So we'll come back to those your responses. Dr. Saleh, you want to start? Yes.
Then I'll start in a different way. Bismillahirrahmanirrahim. So we believe that in Quran, which is the holy book for Muslims, everything is there. When we talk of family planning, it is there. When you talk of breastfeeding, it's there. I can give you the second verse, the second surah of Quran. The second surah of Quran, in one of the parts it says, parents have to breastfeed the child for 2 years. And the science and the researchers says the same. So most of the time, we implement projects which are going along with us. So we don't implement, let's say, something to do with the same-sex marriage. That one is not being taken in. But some other things which are also mentioned in the Quran, we go along with that. So this is in short to answer your question.
Yeah, Thank you. Maybe you can give him a verse on the gender-based violence, how we are prevented to address our women in this area.
There are special verses in Quran which mention women. There's a special surah in Quran is for women, and also recognition of women. Let's say for Muslims, if you want to address Muslims, you have to mention them as men and women. Maybe I can say, I don't want to complicate, but I just want to say that we mention, like, we don't say people, we can say men and women. Like they're saying, if you want to be a gentleman or gentle lady, you have to say ladies and gentlemen. So in Islam, it is there already. And Quran has been there in the last 1,446 years. So when we say now, maybe the etiquette, you have to address ladies and gentlemen, that has been there in Quran ever since. So this is just to mention some of the things which are there to recognize the women. And when we come to the things of inheritance, let's say, in Quran, because recently I was planning for discussing about the inheritance, and then it was mentioned that, and the people who were mentioning this were the lawyers. They were saying it's only Quran which categorize the inheritance. There's a traditional law and there's a law which is being used by the government. These are the things which divides the inheritance according to the situation. But in Islam, it is there. If you are a woman, you have your own share. If you are a man, you have your own share. If you are a daughter, you have a share. If you are a boy in the family, you have a share. If you are maybe from not biological father, you have a share also. So everything is being categorized. We know that majority of the causes of GBV, gender-based violence, among them is issues of inheritance. Thank you very much.
Thank you very much. I know when you were asking that, you were thinking of family planning, even this child this person is taken care. So he shared the second question. ICT data. How are we, whatever we have said, if they want to go and read, where is it published? Where is it?
Thank you very much. Maybe I want to start from the GBV part. Bit and what come to what to do. In fact, what we say is something that is very important in addressing and harmonize the community is the religion. If you want to harmonize the community in an easy way, is just for religions. And the historians say that even the whites, when they come to Africa, they just use religion to make us very peacefully colonize us. Okay? So the same way, if we want to harmonize the community to restore the community from the gender-based violence against children, religion is a very important area to consider, apart from the government efforts. So, coming to religion, actually, these are discrete units. That we say that if you're talking of Christians, it's a certain group that will abide to the mode of life. If you're talking of Muslims, it's a discrete group. It's a discrete group. If you intermix the program, it will only gather those who are within that group. For Muslims, we say it has a number of religious teachings towards gender-based violence and violence against children. I just take out one note that in parenting, we say that Muslims, they are allowed to stop their children because of what I've just straightened away. But the one who said the same never stop the children. There are ways before going to reach such punishment. And there are ways to make children not getting punishment and still get to know the good parenting. But currently, going to our madrasa, we find even memorizing Quran is a punishment event. So, in our programs, for instance, with Jamii Bora, we had what a research, and we did a research, and we did what a program called the Gender-Based Violence and Violence Against the Children that have addressed only teachers of matters. Very unfortunately, coming to the second question, is that we are forgetting part of what of addressing our findings, and we usually think that whatever we did for Allah, and we don't want to showcase our thing. Probably this is our challenge, and we are going to take it, and we took what a step that we need a small part that whatever we are doing to link it into the dashboard of our ministry, so that it's seen that we are doing something. But in fact, many things have been done. Even in Zanzibar, we did a fantastic and amazing program.
I think you have raised an important question. If you have not written it, you have not done it. We have done a lot, we have not written, and we have to. We have no excuse about that. There are some of that, yes. But there is a hand here, before I forget.
Yeah, concerning the reports, Bakwata is also working in the interfaith arrangement, whereby interfaith, that means there are different FBOs which are joined together and doing some work. And as I mentioned here, Bakwata is among the reliable stakeholders as far as the emergencies are concerned. So in all this, of course, we are writing reports like writing and sharing reports to the Prime Minister's office, and also sharing reports to the Minister of Health, and also if it is the health establishment, we share reports according to the level which is supposed to be shared.
So we have a lot of very literature, but you are going to still stand. We have not published. We should do that. Goodbye. See you later. Now, I think I've said 10 minutes. Thank you.
Thank you very much for the presentation. Very insightful, and I just congratulate you for the work that you're doing. So my name is Bernard. I work for an organization called HI 360, and we do a lot of HIV prevention, care, and treatment programs across several regions, probably 11 in Tanzania. I have two questions. One, from Bakwata's standpoint, what is your thoughts around working closely with non-faith-based organizations, particularly in the areas of sexual reproductive health, gender-based violence, and other opportunities for us to collaborate? Because I think sometimes if you don't collaborate very well, then there's a lot of narratives that go on that sometimes are not factual, but sometimes I look at it as lack of really understanding and awareness of how we do business. The second part of it is on the areas that Mahende mentioned, which are also my areas of interest. We do a lot of gender-based violence prevention, we do a lot of sexual reproductive health, and I'm surprised that I also saw rights on this, on that. And so I wanted to understand, for us, let's be honest, when we talk about sexual reproductive health, it is sexual reproductive health targeting every citizen who requires sexual reproductive health, regardless of their age, sex, gender, sexual violence. How do you see your approach being different from our approach as folks who work in non-faith-based organizations, but all working together to improve the rights of the communities that we come from? Thank you.
Okay, so let me take all the three and then we answer them together because time is gone. There was a hand there. Okay, let me take three and then you answer.
Hi, my name is Scholastica Williams and I'm from Deloitte Consulting, and I want to thank you for the presentation, but I also want to thank you for the work Bakwata does on communities, because I can personally attest to the involvement of Bakwata in a lot of the achievement of the targets that we reach through using the faith-based entities. And mine is not a question. And initially I thought maybe I want to challenge you, and I thought maybe I don't want to challenge you, I want to inspire you. The entry point of religion is very pivot in our lives, as it has already been said. It also has been said how we compete for resources everywhere. And we have also started competing for resources using our own faith-based entities. But we know on the ground when we're implementing the programs, we find every health, every faith-based entity on the ground. That's how you win in the law. So I want to inspire Bakwata to go back to interfaith and collect all your partners and come together with strategies how we'll reach the last mile. We still have some children who are not on treatment. We have a growing problem of gender-based violence. For whatever excuse, people have ways and means to try and use traditions and religion to excuse individual behavior. So I want to inspire you to go and take the form of it and converge all of us to use this entry point to start discussing how, as Tanzania, we're going to address chronic issues that contribute to gender-based sexual and reproductive health issues and HIV infection. Asante.
Thank you for the wonderful forum. My name is Kathleen Mora. I work for Urban Care Health Center here in Zanzibar as a clinical nutritionist. And you mentioned issues on preventive measures. So I would like to focus on matters nutrition. What is Bakwata's stand in terms of educating the public and the community? Because I believe in faith-based situation, this is why we could introduce nutrition measures from pregnancy to adulthood. What is your stand on matters nutrition? Because it is a huge challenge in Zanzibar. Most of the people wonder why we need a clinical nutritionist. You have nothing to offer. So what's your stand on that? Thank you so much for a very good presentation through the title there. My question goes to one of your way forward. You say you're going to adopt quality assurance standard. I wanted to know which one are you planning to? Thank you.
Okay, so start from there this way, and what is the way we are tapping and they are treated.
Thank you very much. I would like to touch upon the two questions on issues of sexual and reproductive health and also issues of the last one, which
we have run out of time, so just...
Yes. I would like just to mention that we are sitting with the Director of Health and Social Services of Bakwata, and she's been leading the project, which is about sexual and reproductive. So I think it would be ideal if you can network with her. If she's sitting just in front of you, then you can just be networking there, then you can get the inner side of it. Concerning the nutrition, I mentioned here that we are working with some other FBO organizations like Catholic Relief Services. You know, recently we have a project which it is a CRS project, Catholic Relief Service project, on which Bakwata is in. And we are trying to pilot 2 regions in Tanzania, Tabora and Mbeya. And the things which we are talking about is the early childhood development. And one of the entities in that is the nutrition. So we've covered so far the Barani district, Chunya district, Tabora district, and Kaliua, therefore. So it's like we are already in it. So it will be ideal if you can network and if you can welcome us to Zanzibar. You might be having the resource, then we are. Thank you.
Mariam, join me, Vicky, if you can pass.
Yes, just to set time that we are ready with what you spoke about from the north. And since I know you and I know that you're my neighbor somewhere, then I think I'll start from there. Thanks.
Thanks very much, Moderator. I think the brother asked you on the position of Bakwata working with non-profit organizations, and Sarah has pointed that the industry is close to you, but Bakwata is big umbrella, several organizations within. We have also those like ours and Laura, which are also open to work on areas which you think you can agree. So you are all welcome for the program, then you can say, okay, do that. Another
issues. Thanks very much, Scholar, for the inspiring celebration, and we will take that all question. Also, I'll pass my credit.
So thank you very much. I think we set out to tell you what we are doing, and we have tried to do that. And by your questions, in the spirit of which it seems we might have adjusted what we planned. But I think the question from today about documenting and publishing is where we can refer people to where to check. We have differently as we go. Thank you very much. The room was hot, the time was hot, but you stayed to the end. I have nothing to give you, but thank you very much.